Botox tips you wish you knew sooner. People think that Botox is literally just targeting lines and wrinkles.
Botox is commonly used for things like overactive bladders, which you wouldn't think it could be used for. But what about the sun damage? What about the ethnicity? What about how thin the skin is?
Or when you've been smoking, using sunbeds. You rarely see that end of the spectrum coming to the clinic. Botox tips you wish you knew sooner.
Today, we're going to be talking about misconceptions about Botox.
So there are a lot of misconceptions out there. You know, we get frightened patients coming into clinic saying, please don't make me look frozen, plastic, that Hollywood, you know, the old school Hollywood look. People think that Botox is literally just targeting lines and wrinkles, and you know, you only come in when you've got those big 11 lines, or you've really got a lot of lines on your forehead and across the eye area, and that's when you need to come in and have toxin or Botox.
And there's a lot of scary words associated with it. For example, frozen, or the word toxin, or the word plastic, and you know, all of these words are really off-putting for a lot of people.
Yeah, so it is scary. So here we're going to break down all of these myths and misconceptions that you might have.
So Botox is the top non-surgical procedure that's been done worldwide.
Yeah, there's about 7.3 million procedures performed just in 2021 recently.
And that's also echoed in our clinic, where this is clearly one of our most popular treatments.
Yeah. So Botox treats a lot more than just fine lines and wrinkles. It's used for a multitude of other things. So for example, migraines is a really huge condition that a lot of people suffer from, and it can really be helped in certain cases with some toxin or Botox.
Even very different treatments that you might not have even thought of are increasingly becoming more common now. For example, Botox being used in the traps, so trap Botox or trap tox, or some people call it Barbie Botox more recently. But essentially this is where the injections are done to slim the muscles here and here to give us thinner appearance of the neck.
Yeah, and then there's other things as well, like for excessive sweating in certain areas, like the palms of your hands, the soles of your feet, or under your armpits. So Botox can target not just muscle, which is where it is targeted in most places, but here it's targeting the sweat glands themselves that are overactive in some people, and it can really reduce the amount of sweating in that area. That can be really quite debilitating for some people.
Another really common one would be for some people, they've got some really strong muscles here in their jaw, and if these muscles are a bit too strong, it can cause them problems like grinding their teeth. It can give them headaches. It can cause
issues
a lot
with their teeth as well.
It can cause a lot of pain in some people. So for that type of person, these treatments can relax the muscles and improve the pain. Depending on how this treatment's done, it can be done in a way where we actually slim the face from the front profile. It can help protect the teeth if you're grinding your teeth too much, and it can improve pain as well in that area.
Another key concern that it's used for is facial palsy or Bell's palsy, where some people suffer from a paralysis on one side of their face due to a viral condition or a multitude of other reasons. And Botox can actually help rebalance the face and the structures of the face for a period of time whilst that's healing.
Even within the NHS, Botox is commonly used for things like overactive bladders, which you wouldn't think it could be used for. It's used for treating muscle spasms and dystonias. So it's got such a wide range of uses, not just in the face, but in the whole body overall.
So now we're going to talk to you about what Botox is used most commonly for, and what it's most well known for is to treat the fine lines and wrinkles of the upper face, so this area of the face. So Sanjay, at clinic, me and you generally like to talk to patients about this Botox spectrum that patients lie on. So can you tell us a bit about that?
So I guess when someone first comes to clinic, they might have this idea of a frozen look aesthetic, which is typically what you might see on TV. It's going to be very Hollywood, a shiny face, plastic, very little movement, and it looks quite fake and artificial. So this is going to be the extreme end with high dosing frozen look aesthetics, which actually not many people here at all want.
And actually that's probably what most of you think of when you think of Botox, actually, because that is what makes the headlines, goes viral on social media, and that's what people look at. We rarely see that end of the spectrum coming to the clinic. So then we have the other end of the spectrum, which is more your natural look, preventative baby Botox end. So let's describe a little bit about what that is. So generally, one of the main questions that we get asked is, what age shall I come and get get toxin or Botox done? And that is a really I find quite a difficult question, because it varies between person to person and lifestyle factors, and even your everything from your genetics, your skin color. All of these things play a vital role in deciding when and how much toxin you get done.
Yeah, so age is just one parameter. So a lot of people get fixated on the age, but what about the sun damage? What about the ethnicity? What about how thin the skin is?
Or whether you've been smoking, using sunbeds. There's so many factors that can increase or even reduce the amount of lines that are on your face.
I think you had a patient last week who came in their 50s. They wanted Botox for the first time ever, and you said no.
Yeah, first patient I ever said no to, who is in their 50s for Botox. So she was a woman of color, religious user of SPF her whole life, stayed away from the sun, not a single line on her. So it can vary. Good genetics probably as well. So it can vary from person to person. So, in some 50-year-olds we reject, but sometimes people in their late 20s, early 30s, they're ready. So what does that mean? So baby Botox is done in people that want to maintain movement but reduce the lines. So they don't really mind having a few lines here and there, but they want to really reduce them and also prevent new lines forming in the future, because where you're relaxing that muscle, you're not freezing the muscle, you're relaxing that muscle, so that muscle isn't able to move as much, so therefore it's not going to create as many creases on the face, therefore you're going to prevent those creases from forming. So for you, on this end of the spectrum, if you get toxin done or baby Botox, very small amount of Botox done in the face, in this upper face area, you will not then develop those lines. So you're using it as a preventative strategy. So that is a really, I think, one of our most common ends of the spectrum in terms of where we treat for toxin.
But also in terms of how we treat people in general, so this isn't just related to Botox, but most treatments that we do in clinic, it's always good to start subtle. Because if you start subtle with anything, we can easily increase it over time or in the future. But if we start subtle, we're always going to be more towards the end of natural look aesthetics, which is usually what people are more scared of, because people don't mind kind of taking time to get there, as long as it always looks natural. But people mind a lot the idea of suddenly looking frozen or suddenly looking fake. That's really what scares people. A really common thing that people think and people say to us is, I wanted to wait for as long as possible before getting these treatments done. And when they come to clinic, they will have fine lines and wrinkles that might be quite deep already to begin with.
And they're static, right? So they're there even when you're not moving your face.
So they've come to clinic and they're saying, well, I've got these lines, they're quite deep, they're bothering me, can we please do something to get rid of them? At that point, it's actually a little bit tricky, because if we were to use a baby Botox dose to try and treat this, it wouldn't really it wouldn't do anything. So actually, if you've got deep static lines, which are lines that are there even at rest, so when you're not expressing, they're just there, those types of ones, firstly, they only get deeper over time. So if we do nothing at all, they're going to get deeper and deeper, because these are how lines and wrinkles form. But if we do treat it, we might need to use more of a moderate dose, because actually if we use a really, really light one, it might not do anything.
So they're more in the middle area of that spectrum.
So just to further develop that, some people might be thinking, oh my God, I might notice static lines. Have I left it too late? And I can tell you a story. I mean, we had a patient from about a month ago, and she had a really, really deep frown line, and I think she had a big event coming up soon. It was really bothering her, and she said, well, this has bothered me for years and years and years. I've got a big event coming up in a few weeks' time. I want to get rid of it, so now's the time to get rid of it. And she came in, and unfortunately in her case, because it's so deep, it isn't the sort of thing that's going to respond really well to just one treatment, because over time, when you've got a really deep static line, in time it will improve with each treatment, but because the muscle is so tense, we're a bit limited with what we can do, but we can improve it in time.
And you don't want to blast it with so much toxin that you're then on that end of the spectrum. So it's a balance game for sure. And definitely patients are becoming more and more educated, and we're getting less patients that, for example, will come in at, in their 50s, 60s and say, right, now I'm ready for toxin, and they've got really deep lines. And they said, I just wanted to wait for them to get as deep as possible, and then I was going to get some toxin. But please, doctor, I want to keep it very natural. That's a very difficult balance to strike, because just by default of the lines being deeper, you therefore have to use slightly higher doses if you really want to touch them, which then means that you're going to be slightly moving more towards that frozen end of the spectrum. So it's all about a balancing game, like how much do the lines bother you enough to go to more towards the frozen end, or do you want to just be happy with a bit more of a reduction? So I think education around preventative toxin, if it is something that bothers you, is key. If it's not something that bothers you, then just continue.
So I think the take-home message is almost, when you're thinking about when the right time is, if you really want to focus on natural look aesthetics, it's better to start a little bit earlier but go more subtle than wait too late where we have to use slightly higher doses if the biggest priority is natural look aesthetics.
And we've got a whole other video on all the other things that you can do pre-Botox to help prevent lines on in the upper face as well. So there's numerous amounts of creams, devices, and there's so much that you can do before you even step into the realm of toxin and Botox. The other questions that we get asked is, how can I prolong the results of my toxin or Botox treatment?
So the first thing is the dose needs to be correct for you and your anatomy and the type of result we're trying to create. So as I've already said, generally speaking, it's better for us to start subtle, because if it's underdone, we can add a little bit more. So for a first-time patient, we typically like to review people at the 2-week mark, because by that point, we should either have it close to perfect or just under. If it's just under, it's a little tweak to move us towards a better result overall. And then in the future, that's going to be our starting dose, because we're going to add these 2 doses together, and that's going to be the specific dose for your anatomy moving forwards.
Number 2 is to incorporate lifestyle factors. So for example, trying to do things that are going to help reduce your stress levels, whether that's, exercising more, eating healthier, doing other lifestyle things like meditation, yoga, etc. That can really help reduce the strain on your body. And when we are stressed, we tend to frown more or concentrate more, and those muscles get more active or activated more, which means that the Botox will wear off a little bit quicker.
Even simple things like sun protection, they're just going to protect the thickness of your skin.
Yeah.
Number 3, zinc supplements can prolong your toxin. So there have been a lot of papers that have come out which are looking exactly as to how and why zinc can be used to elongate the result that you can get with toxin, along with the other health benefits this might have.
And there's actually been published data that says that there's an increase in longevity of your Botox treatment by 30%. Thank you so much for watching. We hope you found that educational and useful, and if you have any questions, please let us know.